Welcome once again to our Herbcast, everyone. Today is a really exciting conversation about urinary tract infections and kidney function, an area that we often overlook or sometimes feel we're a bit short of tools for. We want to take a broad look at this, and I'm really happy to welcome Dr. Sally Moorcroft to this conversation. Herbal practitioner, but obviously a lot more besides. You've got an interesting backstory, Sally, so maybe you can introduce yourself and how you got to this place.
Yeah, thank you, Simon. So thank you for asking me to come onto the podcast. It's a real pleasure. And I have I found my way into herbs sort of well, I suppose everybody has their own story, don't they? But mine really started before I went to medical school. So I just worked as a nanny actually for a year in Drôme-Provence, which I just answered an advert. I went out there as a gap year really and spent a year living with a family who I didn't really know before I went, but actually were working in a anthroposophical school. So actually used all anthroposophical medicines, and that included lots of herbs and homeopathy. And as part of the family, I was just really introduced to it then. So, and actually also the culture in that area of France, the herbs are very ingrained into the culture. It's a big area for sort of organic and biodynamic farming, and we were living in a valley with the lavender, so you would see the lavender being harvested, and my walks every day were in the lavender fields, and also around the house we had lots of wild thyme growing, so I just got really immersed in it. And that was sort of my first introduction, was living there. And then I went off to medical school, following a fairly normal, conventional path, really. I was planning on going into GP training. But through my studies, I went to different places. I did one of my electives in my fourth year at medical school. I went to Australia, and I ended up in an Aboriginal health centre where we went out into the bush really. And so I sort of tagged along with some of the elders going out into the bush and learned about some of the bush medicines. And so that was really interesting. And then I spent another elective working in India. So had more introduction in India to homeopathy, which is very big there, and the Ayurvedic medicine. So I was kind of already interested. I had an allotment. I was growing lots of vegetables. So and then I had some health problems myself. So I sort of started looking at options for treating myself really. And I think from there, it just kind of my interest grew. I remember even then we started reading a book about TCM medicine. And so I was kind of looking at lots of different ways of approaching medicine. And then I worked in the hospital for several years. So I was just doing general medicine. I worked in neurology, which obviously we're going to be talking about bladder and kidneys today. So I did some work there. And I kind of knew that now my eyes were open to all this other way of doing things. It was very difficult. I just felt like a round peg in a square box. I was taking my chamomile tea to work, and it was a long time ago. Things were not very accepted back then. I was also interested in the microbiome, so I'd started looking at research into using, say, for some of our patients with Clostridium difficile, trying to introduce this into ward round meetings, and it wasn't going down very well. So I
When was this? When was this, Sally?
This was 25 years ago.
Yeah, so you were really ahead of the curve, weren't you? Yeah.
So it was not going down very well. And I kind of felt like I can't do anything. This is not the right place. I just felt like I couldn't change anything. It's a really hard system to make any even minor changes. And so I'd sort of, started feeling a little bit kind of I'm not in the right place really. And I wasn't quite sure where to go, but somebody gave me a leaflet for the herbal medicine course at the Scottish School of Herbal Medicine. And this was before the internet, so it was actually a leaflet that I then had to kind of find out about. So I went and met Keith and Maureen Robertson, and anyway, ended up going there. So I went to Glasgow for 4 years and did the herbal medicine degree with them. And that was really great. So And after that, I kind of always thought I would go back to do GP and I would bring the herbs into my practice. But actually, almost as soon as I left and finished my degree, and I just started a small private clinic working in my parents' house initially, which was at the back of the house. They made me a little kind of section that I could use. I was just busy straight away. So within about 3 weeks, I had 45 new patients. It just went crazy, like, and it sort of didn't stop. So that was 20 years ago. So I've had a busy clinic now for 20 years. I've done lots of additional training along the way, mainly led by patients, where I felt like my gaps were. I felt like I had a big gap in nutrition. So I've done lots of nutritional training. A lot of kind of in the functional medicine vein, but also sort of some Ayurveda. I like to sort of span a lot of different ways of looking at the body, because I think everybody's different. Some people one system fits, other people it's really good to have a different head where you think, okay, that is a better system for you. So I did TCM training with dermatology. That was really helpful. Just using the Chinese herbs in those cases particularly helpful. I did medical acupuncture training, so I use that a lot for pain management, particularly arthritis. So I'd often do herbs and acupuncture. Then I did the 5 years MF Hom training in Bristol with what was the Portland Centre of Integrated Medicine, now is the National Centre of Integrated Medicine, and I teach there as well. So I've stayed in contact with Bristol, and that's really nice to have that contact. So I did the MF Hom with them, and now I teach herbal medicine on the Diploma of Integrative Healthcare, which is a really great master's course that they run. Yeah, for healthcare professionals.
Well
so I'm one of the core tutors there, and have done the herbal medicine module. And then in my practice, it's kind of evolved over the years. So I was very general to start with, and enjoyed seeing general patients, but I have definitely tailored in probably the last 5 or 6 years, particularly mainly I've just seen lots of the same cases. So it's ended up being mainly women's health, particularly menopause, perimenopause, and complex hormone problems. So I do see lots of people with endometriosis and polycystic ovaries and complex menopause problems. And then to kind of go into that, because I've got into that, I've done I use the bioidentical hormone. So I did the training with Marion Gluck to offer those, and I'm doing my functional medicine certification with IFM. So I've just finished all the modules, and I'm doing the certification next year. So
you don't stop learning then.
Yes.
Well, your caseload is going to be relevant for our conversation today, isn't it? Because we're talking pelvic health in a broader sense, aren't we? So, I was just introducing by saying, well, on one hand, we think we've got a few handles on urinary infections and urinary problems, but kidneys tend to be a little bit more troublesome for us as a concept, as an organ, as a treatment strategy. So let's sort of work our way around the whole kidney and urinary tract. You obviously had some training in the Chinese approach. Obviously, what they talk of as kidneys is different from what we talk of as kidneys.
Yes.
But it also, they have bladder, don't they? The concept which is closest to our urinary tract things, and they have their own views about the links between that and other parts of our health. So you've probably got a broad range of influences on this conversation, don't you?
Yeah, I do. And I've used different methods over the years. I think for most practitioners, there's always a little bit of nervousness around kidneys, aren't there? So and I know we talked about this when we were getting ready for the podcast, in that I suppose over the years, I've felt very comfortable with treating sort of urine infections, and found that responds really well to herbs, and is a fantastic, it's a fantastic way of avoiding excessive antibiotics and giving people empowerment to have something, they can keep at home, and it's in the cupboard, and when they get the first sign, they've got something they can use. that's something
We'll talk about what they are later. Yes.
yeah. So that I feel like is kind of, really it's a way that herbs can be really helpful. The other probably angle that I've looked at more recently in terms of I seeing lots of people with women's health problems is the effect of hormones on that system and the changes that happen around menopause, which you know is interesting and also can cause a lot of distress for people and probably isn't very well talked about. It's probably not something that is up on the top lists of people's menopausal symptoms, but actually can cause a lot of distress again.
Yeah. Yeah.
And then I suppose recently I've also started, I do a lot of work with sort of microbiome, and we partner as our clinic, we partner with In Vivo and work really closely with them and use a lot of their microbiome testing. And they've just introduced a bladder microbiome test, which so I'm kind of I suppose at the moment I'm quite interested more recently in looking at the connection between the gut microbiome and the bladder's own microbiome, and with the vagina as well, because I see lots of women with like vaginal infections or atrophy or issues regarding the menopause changes around the vagina, but that often affects the bladder as well. So
Absolutely.
that's probably where I've kind of steered into more recently.
Well, it's very interesting. I mean, I'm sure we'll pick this up in a moment, but some of my own work on the microbiome, the kidney and urinary consequences of dysbiosis were early picked up on, and the connection between what happens in the bowel and the urinary tract is clearly very well established now. Yes.
Yeah, it's interesting, isn't it? And we've got this, and I think with the herbs, we've got this interesting reflex reaction as well, haven't we? With the way that sometimes herbs also affect the gut and then have this reaction in the bladder too, and how you can use those. So it's just how it all ties together. It's really interesting. I mean, I could lead that into one of my cases, maybe.
Well, I was going to say, this list gets down to the nitty-gritty. So where would you like to start with an example?
Well, maybe I'll mention that then, because I brought 3 cases. When I was looking through, I was thinking, okay, what shall I bring? And trying to something that's going to be interesting and also quite relevant. So I mean, over the years I've seen different, there's been some really complex. I mean, the other one that I could have brought was a prostate cancer man, but it was a very complex one. But that just suffice to say with that one that he did really well. He was it was a palliative care. He refused chemo and really just wanted things for supporting quality of life. And had been given sort of 6 months. But actually the herbs were fantastic in that instance in terms of improving his quality of life and symptoms. And he lived another 18 months. And so I have used them in other cases, but that was a massive case and it was really complicated. So I tried to pick more simple ones. So this lady I brought because I'm really interested, because I've just used the urinary ecologics test on her for the first time. I've used this microbiome testing from In Vivo, and she was so she's a lady of 37. She came because she had bladder instability problems, so having lots of frequency and urgency, which started after pregnancy. So she's got 2 children, aged 3 and 6, and it happened after her second child, so 3 years ago started. She's seen the urologist and he'd sent her for some pelvic floor physio, which has helped, but she's still got really bad symptoms. So I haven't seen her in terms of follow-up to a conclusion yet. So this is early days, but it was just interesting what came up on the test. So her other relevant history is that she's got very heavy periods, from which she keeps getting anemic. She also did have quite traumatic births in that she had forceps von 2 with both labours and lots of tears. And with this kind of feeling of frequency and urgency, she's had occasional antibiotics. She said she feels like it's there all the time, like this tenderness, suprapubic tenderness, going, nocturia. She feels like there is a mild infection in the background all the time. And she's also quite stressed and busy. She works full time. She's got 2 small children. She's got quite a demanding job. So I just did some initial tests with her. I sent her for a pelvic ultrasound. We did some bloods which showed that she's anemic again. Her ferritin's 10.4, so very low. Her vitamin D was low as well. B12 was low. So I think, and she was anemic. So in terms of the fatigue, there's quite a lot going, there's a lot of reasons why she's feeling tired. And then I did a Dutch test on her, which is like a really useful hormone test, which showed estrogen dominance. So she's not really clearing her estrogen very well. And so we've done some initial work. I did quite a bit of work with her on nutrition in terms of blood sugar balance and increasing iron-rich foods, and then some initial supplements to help, so just some vitamin D and iron. And I use progesterone cream on her as well, actually, just to try and help support this hormone balance. And then we've been working on estrogen clearance, which is mainly through food at the moment.
What do you do? What do you mean by that? How do you approach estrogen clearance then?
Mainly supporting the liver. So she's doing like green smoothies, linseeds.
Yes.
And
because the liver is responsible for clearing the estrogen.
Yeah. So I'll usually go for liver or gut, because often it's to do with the way that the gut's clearing estrogen as well. So, but I think with her, we were doing this other microbiome testing. I've actually, now she's just doing a gut microbiome test as well because of what came up on this one. So I think we might end up going down that line to help get to the root cause of the hormone problems, because I'll often find there's a gut dysbiosis which is driving the estrogen dominance as well. But I always put some liver support in, and the liver herbs as well. So that's often the kind of way of I end up treating that. So what was really interesting was with the urinary ecologics test is that she came back with no lactobacillus at all. So this is really important for balancing, and it's really interesting when you look at the genetics. So there's different strains of lactobacillus that people have, and their genetic variabilities, but it's related to propensity to urine infections and things, obviously. So but she didn't have any, so I think that was significant with her. It is important. And she had high levels of Enterococcus faecalis, which is significant and can come from the gut. So that was quite interesting. It can cause UTIs. She's got very high levels of it. It's probably coming from her gut as well. So, and then she had some other organisms, which I always find really hard to say these names. When I wrote them down, I thought, how am I going to say this? Acinotignum scali, I think is how you say it, or Aerococcus urini. I think that's how you say it. I'm not sure. I'm just saying them phonetically.
They're very polysyllabic names, don't they?
Yeah, they do.
Because there's thousands of species, so it's not surprising that they get a bit jumbled up. Yeah.
They do.
So not nice ones. That's basically what we're saying.
And interestingly, so when I did the interpretation call after the test, so these 2 organisms are linked with bladder frequency, and they're potential pathogens. So the Enterococcus faecalis is a pathogen. These other 2 are potential pathogens, and she has got them in quite high numbers too. So that was interesting. I've never done that testing before. Probably previously I would have just treated with some herbs and been very kind of general with what I was doing. But this has given me useful information. And then looking into the research a little bit further about the Enterococcus faecalis, there's some interesting, so it can induce biofilm formation, and it's a very virulent organism, often resistant to treatment. So it's quite stubborn. But there is some research showing that thyme inhibits the biofilm formation. And clove oil as well, actually, is also sensitive against it. So I think it's been helpful because it's helped me target. So I'm using antimicrobials now. She started on them alongside some lactobacillus probiotics. And then we're also looking at supporting the sort of mucosa and the integrity of the membranes in the. So we've been looking at doing that particularly with nutrition. Yeah, exactly. And just so basically increasing like vitamin A and C and zinc and vitamin D. That was low when we tested it. And
did you always sort of consider the gut even before you're doing these testings? I mean, when you were approaching something like this, you would go to the gut alongside.
Yeah. That was kind of drilled into us at Herb School. I think that probably was
so. Yes.
One of the things I learned was always treat the gut first. And then I guess as you do more of the functional medicine training, that is the same. So it's probably always, I mean, sometimes there's a chicken and egg with hormones, because hormones are affecting the gut, and with stress as well. Stress affecting the gut's affecting maybe mental health or hormones. So there's this really kind of circular connection between all of them. So sometimes I will come in at all of those just with small interventions to just gently kind of nudge the system in all areas, because I feel like, okay, there's no good me putting lots of work in the gut. This person's still really stressed and their hormones are still completely out of balance. So but I'm just kind of often I'm sort of gently doing a little bit of work on this, a little bit of work on that, and then just kind of trying to help support the system in all different areas, and then be led by how well the treatment goes. So then maybe just kind of modify if I think, well, actually, particularly because it's really hard to get the gut to heal when everything else is out of kilter. So I'm not strict about the order, but the gut would always be primary, number one, and then the other bits will just be, depending on the person, just either supportive or just gently trying to kind of
that's definitely a take-home message, isn't it? Always go to the gut, especially when you're dealing with urinary. Good.
Well, this is a really interesting instance, I thought. So the other thing we've done with her, so I think just with food, she's bringing in the fermented foods now, rainbow diet. So we're doing quite a bit with food with her, and then she's got lots of antimicrobial herbs now. So I'll see how it goes. I mean, she was feeling better with what we've done so far in terms of energy, and her periods have lightened up. So I'm just really interested to see what happens. So
she didn't actually have a urinary infection itself. It was bladder irritability and so on. Is that what we're saying?
Yeah. Well, that's the symptom she came with, and she is testing negative when she's her urine's being dipped. So it was bladder instability, but I think that this, it's hard if the enterococcus faecalis,
or a sort of more broad-based inflammatory condition, I presume.
Yes.
I mean,
That's what I was wondering.
What you would get. I mean, I'm always struck by how small the pelvis is and how much is crowded in there. So there's a lot of jostling going on down there, isn't it?
Like you say, it's hard to know. I'm not sure, but I think by sort of covering the bases, we'll see. Whether I need to put more anti-inflammatories in, I'm not sure. But we're kind of going from mucous membrane support and antimicrobials and the probiotics at the moment. So we'll just see how that goes. So
Good
yeah.
starter. Are we moving on to the next story, or?
Yeah, we can do. So this lady probably is a little bit more what we might just commonly see. I brought this case because it's something I've seen so many times, and it's quite a simple case of recurrent urine infections.
Yeah.
But I think where herbal medicine just works so well, and this is a lovely case because she did so well. So, and she'd had problems for a long time. She was 55-year-old lady. She'd had recurrent urine infections since her 20s, but they'd got worse in the last 4 years. And she was recently remarried. And I think just having sexual intercourse again has triggered it all off. So it's it's really difficult. She's met someone, she's really happy, she's newly married, and now this problem's kind of spoiling everything. So she's finding that even though she's been put on constant antibiotics, she's still having symptoms. And even with changing the antibiotics, she's got constant sort of abdominal pain and tenderness and frequency. And then if she stops the antibiotics, it's even worse. And then obviously because she's having all these antibiotics, she's now getting thrush as well. So everything's kind of all flaring up really. And the symptoms she's getting is burning pain, frequency. I do find interesting as women get older, they tend to lose those symptoms. So they'll just end up with a frequency. And the number of people that I've said, that have come to me, older women who've said, I've got frequency and nocturia, and then we've dipped and I found actually they've got infections, but they don't get any of the burning or stinging anymore. So
interesting point. Yeah,
it's interesting that I've noticed that really that seems to happen a lot, and especially then as you go into more elderly women or elderly people, then it's often just confusion that's the main symptom. So actually they just end up getting very confused, and people have even mistaken it for dementia. I've seen that. If particularly someone, they just get really, really confused. So I always think of that.
It can be quite dangerous at that very late age as well, can't it?
Yeah. So that's always number one to think about. So this lady, so she was having some supplements herself. She'd started on some lactobacillus cranberry juice. She was taking some garlic and some cod liver oil and glucosamine for arthritis symptoms. And the other significant thing about her was she had a lot of stress with her son, who was living at home, who's got Asperger's and autism, quite severe symptoms, and he's kind of housebound. Well, he doesn't go out of his room. So, and she's quite worried about him. So there's quite a bit of stress, and she's been a single mum, and it's been an issue she's been dealing with a long time. So that's in the background really. So she had a herbs, she had a tincture and a tea, and some slippery elm capsules. And we just talked about diet. So this was quite a long time ago, before I started doing any of the functional medicine testing. We were just talking about reducing more acidic foods and spicy foods. So
what do you mean by acidic foods? Just to clarify that, because people have different.
Yeah. So at the time, I've written in the notes citrus, rhubarb, tomatoes, and spices. So that's what I was saying to her. And this was quite a long time ago I saw this lady. And then so her herbs she had a tincture of echinacea, astragalus, althiorad, hypericum, scutularia, parataria, agripyrans, and turnera. So that was her tincture.
So you're actually supporting already a broader inflammatory and energy even base there, weren't you, with some of those? So you weren't just giving straightforward urinary antiseptics, you were giving a broader modulator.
Yeah, I think she needed it, definitely. And I like sort of adding in things like the parataria as well. That I like those really restorative.
I haven't used that. So tell me more about parataria.
I don't know. When we were So when I was at Scottish school, we did do the Gertian. It was every herb that we did.
Yeah.
We had to taste it, and as a
Yes.
class, we sort of. It was a really lovely. One of the reasons I wanted to go to Scottish school. So for each herb, we would all taste it, and then we would just talk about, how does that feel in your body, and what, kind of sensations. And it was nice. It was a really nice way of learning about all the herbs. And that one, and I think we had Christopher Headley for this module as well, which was lovely. So all my notes are from Christopher Headley's notes that he taught us. And the Parataria just came out as being very restorative
Right.
and nutritious. So part of the nettle family, and just that kind of very nourishing but specific for the kidneys and bladder, really. So I think that's kind of always.
You might turn me on to it.
I think I have a strong memory of him talking about it, and so it's often one of my favourite ones to put in for that. So I think, and I'm kind of, I suppose, I often go to do, often kind of choose quite a lot of nourishing herbs as well, because I feel like, particularly nowadays, a lot of people are quite depleted. We live very stressful lives, and that's probably one of the first things that I would think to.
You went to those rather than the small overt antiseptic ones, buku or
Yeah, well,
those.
she had that in her tea, actually. She did have a tea as well. So she had a tea of zea mays, buku, calendula, gallium, and verbascum. That was her tea.
Yeah. Okay.
So that was in there. And then she had slippery elm.
You use the tea because it's got the volume? Is that one of your thoughts?
Yeah, that was another thing that I think we were taught, was that always put a tea in because it makes people drink more.
It's water.
So, and then sort of drink 6 cups a day, or actually just trying to get people to have that volume. So I kind of always do that. So I'd probably even if it was acute urine infection, I'd give a tincture that's a bit more of a bullet, and then a tea which is maybe a bit more gentle, but just tries to encourage people to have the fluids.
Flushes it through.
Yeah, exactly. Yeah. So she did very well. So after 3 weeks, no burning or pain, frequency improved, no antibiotics at all. So basically no symptoms, and she stopped the antibiotics. And then she said she was having some vaginal dryness. So I just added in a cream.
So she was post-menopause at this stage.
Yeah, she's 55. So she's, yeah. So, and I find that's really important to treat that. So any woman, sort of a postmenopausal woman with recurrent infections, you really have to get on top of the vaginal dryness, because otherwise, if the membranes are irritated, then you just get into a cycle of being more prone to getting the infections, because I think the bacteria just track up. There's no barrier to stop them. So if the area's irritated or very dry or atrophy, that's kind of a really important thing to address. So I did give her just a gentle cream, which is a fairly standard one that I use. I sometimes change it a bit, but it's mainly the same. It's a chickweed. Sometimes it's calendula and chickweed, and sometimes comfrey, but often calendula and chickweed with marshmallow root and chamomile, glycerite. And then
as a cream externally applied. Yeah.
So and then that's kind of a standard one. I mean, there's some variations, but that's what she had. And that's it, really. She did very well. So she had no more symptoms, no more antibiotics. I saw her for 11 months, and then the only change I made was that she wasn't taking the tea. She said it was too messy and she didn't like it. So I changed actually the formula because I knew she wasn't taking it. So I just kind of changed to be a formula that had more kind of, that was more balanced if she wasn't going to take the tea. So we changed it so it was echinacea, astragalus, the althiorad, hypericum, skullcap. Then I put solidago in, agripyron, turnera, CMAs, and calendula, and that was her maintenance then. So she was like, she took that for years, and then everything settled and she didn't need it again. But she basically didn't have, I think she had one more infection, which was caused by her being very dehydrated, because she was, when she was working, she sometimes didn't take water bottle with her, but as long as she was hydrated, then that was all good. So yeah, that was just a nice one.
Lovely story, and a good introduction to some of the herbs that are available for us in dealing with that sort of situation. And it's interesting that you didn't include some of the ones that come off the shelf sometimes in relation to urinary infections. You have a broader approach to that. That's very, very helpful. Thank you.
Yeah. No, I think for sort of acute infections, I'd probably still go for those. But I think where there's more complex history, that's where all these other herbs sit, isn't it? They've got all these other, there's a lot more than you can do.
Very well. Yeah. Yeah. Gosh, we're getting through these very, very well and very, very informative as well. But it sounds as though you might even have another story.
I do have another story. Should we do that? So it's a similar vein of postmenopausal woman. That's because that's what I do see lots of. So, but she's a little bit older, so she's 60. And this case is more complex. It's not quite as sort of ideal outcome. It's been a bit more difficult to manage. So that's sort of why I brought it as well, just to kind of show like how it's sort of changed. So I've seen her more recently. So she's got recurrent urine infections. So she has had them for the last 5 to 6 years, and has been having 5 or 6 infections a year. And then when I saw her, she came to me, it's now all the time. So it's gone from being these occasional outbreaks to basically it's just constant, and it has gone into quite bad kidney infections quite a few times where she's been in hospital. So it's much it's got really much worse. And alongside it, she's also just been diagnosed with post-infective colitis, so which has been giving her really loose stools, verging on watery, up to sort of 12 times a day. So quite severe symptoms. And alongside that, food intolerances, so particularly dairy and soya make the diarrhea and abdominal cramping much worse. She's also got a mild prolapse and vaginal dryness. So there's a whole, you can see like there's all of these are going to kind of pull together to make the area very irritated and inflamed. It's, there's lots going on. There's lots of reasons why she's obviously struggling. And I think all of this, the other thing with her is, again, she's had a lot of stress, but this is mainly from working. So she's very driven. She's educational consultant and does long hours, travels around the country, and is a bit of a workaholic. Like she can't really relax. She's kind of and even when she's at home, she's just going to the gym, or she's very busy, very kind of always overstimulated. She's not really relaxing very much. She's got quite a warm constitution as well, which is interesting, and also prone to sinus infections and seasonal rhinitis, occasional thrush, but not too bad considering that she's had quite a lot of antibiotics. And so she's taking cetirizine, which is antihistamine. She's on cefalexin now, broad spectrum antibiotic, which she's now on all the time. She's on cranberry juice, probiotics, psyllium husks, which have been helping with the colitis, and some digestive enzymes and a multivitamin. And before I saw her, she'd been trying a low FODMAPs diet, and she's been having colonic irrigation and having probiotic implants, which has actually helped a lot. So they have actually helped her. So that was good. That was helping. And the antibiotics, she's had now recurrent antibiotics. She's had like recurrent courses for 10 years. And now she's on a course every 2 weeks, which is a 3-day course. So she's
almost constant, yes.
Yeah. So pretty much, and sometimes having to take stronger ones. So
her microbiome is obviously shot to pieces.
Yeah, it is. And I did do a stool test with her, which was interesting as well. So I thought, yes, because of the colitis as well, and I've often found that with people with colitis, it's really worth doing a microbiome test because, you just can't guess. You sort of think, oh, I know what it's going to be. There's going to be this or that, and then you do the test and you're like, oh, it's completely wrong. Actually, it's not at all. And even actually, I've had people with really bad ulcerative colitis that I've done thinking that it's all inflammation. And then we've done the test, and like one man that I saw came back with very high candida, and actually not really bad. Inflammatory markers were not too bad, but his candida was, and we actually treated the candida, and the colitis got much better. So, and he'd been put on steroids. You see, he had loads of steroids for his colitis and steroid suppositories. So, I think that taught me, don't assume, because his symptoms are very similar. But actually, when we'd done the testing, I thought, there's obviously his colitis there. He has got colitis, but it's not that's giving him all these terrible bloating and pain and all the other symptoms. So, anyway, sidetrack. So back onto this lady. So with her, with all of this irritation and inflammation, I really wanted to put a lot of mucous membrane support in. So she had some marshmallow root overnight infusion, which I use quite a lot, which is just the root overnight infusion, drinking 2-3 cups a day, and some slippery elm capsules.
She's infusing it, you mean? So she puts it over in cold water or warm water. Yeah.
Just warm water, and leaves it overnight, and then drinks it the next day. And slippery elm capsules, and some turmeric capsules. And then she had a tincture. So her tincture was a bit more specific, like you said. It's got the book. So we've got the bucku and the Arctostaphylos uva ursi, and she's got agropyron and astragalus and echinacea. She's also got some althiarad in the tincture as well, and shatavari root, which is another one that I use a lot for women, because it's cooling. I think that's why I like that. It's really cooling and demulcent.
And you said she was hot.
Yeah, exactly. So that was her. That was her first mix, and then she did the microbiome testing. And in the meantime, she'd also seen the urologist and had a cystoscopy, and he'd put her on to more antibiotics. So basically, I've seen her for years now. We've been kind of, we've been doing well at times. You've really got on top of it. Then she'll get stressed, and then it'll come back again. So we've tried different things. I found, the testing was very helpful. The testing showed that she's got quite a lot of SIBO symptoms as well. So she had methanobrevy, she had desulfovibrio, she had very little lactobacillus, and very
SIBO
little
means SIBO, just for
Yes,
clarification. Yes.
yeah.
Yes.
So
Short, small intestine bacterial overgrowth. Yeah.
exactly. And although doing a stool test like this is not definitive, it's not a diagnostic test for SIBO, you just get suspicious. If you see the methane producing bacteria like the methanobrevy or the hydrogen sulfide producing ones like the desulfovibrio, then you're kind of thinking it's quite likely. I don't always run a SIBO breath test. I'll sometimes just treat mainly financial. You think, okay, if you've done this test and we've got these organisms, it's fairly likely. Am I going to change? Is it going to change very much me doing a breath test as well? But sometimes we do a breath test. Sometimes, but in this instance, it just showed to me how out of kilter her gut's completely out of kilter.
Did her colitis symptoms change as you went through these treatments?
Yeah, so that totally was cured, really. That completely improved. So that stopped. All of that, she got back to really normal stools. She even managed to reintroduce some dairy. She was going for normal bowel movement every day, and that was really good, actually. And I think that was all of the things we did. So she had her herbs. She had some really strong lactobacillus probiotics, Culturelle GG, the lactobacillus rhamnosus, which has got most of the research on, and Bifido, and then she was rotating antimicrobials like oregano and berberine for the SIBO, and we kept that mucous membrane supporting as well. So with all of that, I mean, the other thing that she found quite helpful was apple cider vinegar, which she started taking, which seemed to be good as well. So so that remains really stable, and even with busy at work. And the only time it flared up again was when she went on holiday and she ate the soya issue did remain, so she couldn't eat soya, and she ate some soya on holiday, and that seemed to trigger it all off again. So but apart from that, if she was avoiding soya, she managed goat's cheese, she was managing a bit of dairy. So
it's a good point to make, isn't it, that sometimes patients bring us almost like as fatalist, I'm never going to be able to have these foods again, I have to cut them out, when all you need to do is to change the environment in there, and suddenly you can take the foods again.
Yeah. I kind of remain hopeful that lots of people manage to do that. Not everybody. And sometimes it's a tolerance thing, isn't it? I always say to people, you might be able to have it now and again as a treat, but you probably can't have it every day. So it's finding that tolerance for people.
Yes,
and
everyone's different.
Listening to your body. If you've had too much, then you need to have a break again from it.
Well, it's another case where you've made the point that kidney urinary are so dependent on what goes on in the gut and their environments. I mean, there's another sort of general point. We're getting through this recording so fast, we're going to have to start thinking of wrapping up. But one of the points I often think about is that the kidney's got the job of cleaning up after, for example, liver detox. Often we were told back in medical school that the kidney was the hand servant of the liver. Essentially, if the liver had a sneeze, the kidney caught a cold. So presumably, when you're wanting to reduce burdens on the kidney urinary tract, you're always looking at what's coming through from metabolism, from digestion, from liver function, and so on as well, aren't you?
Yeah, I think that's the thing, isn't it? You'll kind of constitutionally as well sort of understand if someone's, I'll always do that assessment early on as to, do I think this is a depletion picture or an excess picture? Just a very simple, in your mind, am I nourishing things here, or am I trying to clear things? And
yes,
and that's really
or a bit of
helpful, I
both.
think.
Yes.
Yeah, exactly. Or sometimes a bit of both.
This life is always complicated. Yeah.
Yeah, but I think if that just that, and that's probably helped me such a lot over the years. Just that simple, without getting too complex about things, but just that kind of understanding, like, what, is this person, and if you do feel like there's this excess toxicity, or there's a heavy burden on the liver, or I see it with the hormones as well, like women with these massive high estrogen levels, and all this history with endometriosis and fibroids and breast cysts, and their estrogen is just not clearing at all. That you have to just start opening all the channels up, because that's driving that. I mean, that drives inflammation, doesn't it? You've got that whole
Right.
high estrogen aromatase inflammation cycle, which is really damaging. So it's, yeah, I totally agree. You've got to just carefully open everything, and then also support the lymphatics, just to,
Yes.
because that's the other thing
Because
I always
they're
think
all
with the
playing
bladder.
a part
If you're going
down
to
there.
support the
Yeah.
bladder, support
Yeah.
the lymphatics, and do
Yeah.
that too.
Well, of course, that's where things like pelvic exercises and breathing and so on can help, because they're helping to clear the junk out from that area that tends to build up, aren't you?
Yes.
And sitting in chairs must be one of the worst things ever
I know.
for any urinary tract problem. Yeah.
Yeah, it's true, isn't it? We should all be at those bicycle desks.
While you, cycle while you work. Yes. Or
Yeah.
have like, I've got a sit up, stand up desk, so I sort of
Oh,
move
well
up and down
done.
when I'm working. Yeah.
That's
Yeah.
good. I
Just
work
keep
with
the pelvis a
a
little.
nutritional therapist who works in the Netherlands as well. I work with him, and he's always on his cycling desk. It's a real thing over there, isn't it? Like, I just think we haven't
Well,
adopted that.
they do like their cycles. Yeah.
Yeah.
Well, this has been really, really, really informative, Sally. So thank you for taking us through these issues so clearly and so well. I think people listening to this will have really learnt a lot. So we're really, really grateful.
Okay,
So,
you're
have you got
welcome.
any sort of final wrap-up thoughts? Your own sort of conclusions or one-off suggestions?
No, I think probably we've just sort of covered it as we've been going along, really. I suppose I was always taught to, the one thing I suppose I have always thought, which is what we've talked about, is if you're going to use the stronger antimicrobials, just make sure you put that the nourishing restorative herbs in as well. I think that's probably the thing that
good.
I've kind of learnt to do that makes a difference. Yeah.
Yeah. Well, thank you for that. We really have filled the time so well. So thank you again for joining this Herbcast, and I'm sure you'll get a lot of plaudits from those who have listened to it. Thank you very much, Sally.
You're welcome.